Why under-eye filler swelling happens months later and why it's hard to predict. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. Have you ever had under-eye filler, and everything looked fine? Then months later, you suddenly notice swelling? Not straight after treatment, not even weeks later, months later. Why does this happen? The common assumption: most people think filler problems happen early. You inject, you swell, and then it settles. That's what we expect. But the under-eye area doesn't always follow that pattern. Patients often come back months later and say, "It was fine before, what changed?" Why the under-eye is different. The under-eye is not like the rest of the face. It has very thin skin, minimal structural support, multiple fat compartments and delicate lymphatic drainage. This makes it extremely sensitive to fluid. Even small changes can become very visible. It's not just the filler. Here's the key point: the swelling is often not just the filler itself. It's the way filler interacts with fluid. Hyaluronic acid attracts water. Over time it can draw in fluid. Surrounding tissues can retain fluid and drainage may become less efficient. So what you're seeing is often fluid sitting around the filler. Why it happens months later? So why the delay? Why not immediately? 1. Gradual change. Filler doesn't behave the same over time. It slowly interacts with surrounding tissue and fluid. 2. Aging. The face continues to change. Ligaments weaken, fat shifts, and skin becomes thinner. This alters how the filler behaves. 3. Lymphatic function. Initially, the body may cope well. But over time, even small inefficiencies can lead to visible swelling. 4. Triggers. Patients often notice swelling after poor sleep, illness, allergies, and hormonal changes. But these are triggers, not the underlying cause. Why it's hard to predict. This is the challenging part. Even well-performed filler can become problematic later. Because prediction depends on individual anatomy, lymphatic drainage, skin quality, and how the face ages over time. And these factors are not fully predictable. You can do everything correctly, and still see delayed swelling. What we're learning: we now understand that filler can last longer than expected. It can sit in different tissue planes and fluid can accumulate around it. This explains why results can change over time and swelling may appear later. Clinical reality. So what does this mean? Under-eye filler requires caution. Patient selection is critical. Expectations must be realistic. A good early result does not always mean a stable long-term outcome. The key takeaway: under-eye swelling months later is not uncommon. It's often related to fluid dynamics, not just the filler itself. And it remains one of the most complex areas to treat. Thanks for watching. Like, comment, subscribe, and share to support the channel.